Hi, my name is Morgan, and I did my site visit at Trifecta Therapeutics. So, the first thing, what I learned and my reaction to it. So, the first thing I answered was, what does the day to day job actually look like? When interviewing my person, he stated, my day to day is evaluating patients, follow up visits with patients, maintaining order in the clinic, and trying to keep things smooth and flowing. Helping out if we have any walk ins, dealing with potential patients that walk through the door. And he also assists with our shadowing program. What I learned from shadowing or the site visit was that the day to day job looks like how PTs structure their schedule, how they evaluate their treatment sessions, their documentation. I also noticed the variety of patients that they see, whether that's orthopedic, neurological, pediatric, sports, mainly sports, because Trifecta Therapeutics is a sports rehabilitation therapy center. Second was clinical researching and how PTs make decisions. It's how they assess a patient's movement, strength, pain, and function, or how they choose to appropriate interventions such as exercises, manual therapy, or they did. I know at Trifecta they did cupping and needling, so a bunch of that stuff. Third, the emotional side of the profession, the challenges of seeing patients in pain or dealing with slow progress, and the reward of helping someone walk again, return to sports, or even regain independence. Another thing is how much burnout can happen, and how PTs try to maintain that balance. And for the fourth one, the business and administration side. So the insurance impacts, how much time PTs spend documenting notes, or the difference between outpatient, inpatient, home health, and different school based settings. Next, what appealed to me the most? The three things that I could think of that appealed to me the most was the team atmosphere, the relationship with patients, and actively interacting with patients. So for the first one, the team atmosphere, I had a chance to shadow Trifecta Therapeutics for over 10 hours, and what really appealed to me the most was how close they were as a team. They all helped each other out, they all assisted in different exercises, they asked for feedback, and it was really nice to see. Another thing was the relationship with patients. The patients that I saw with the person that I was interviewing and the person I was shadowing, because it was the same person, he interacted with the patients really well. They felt that they could tell him about their days, their activities, what they were doing, and it just made for really good conversation. The job also offers a variety. Each day brings different patients, different conditions, and different challenges, which keeps, in my opinion, the work engaging. Many enjoy a mix of hands on treatment, problem solving, and one on one interaction. And the career provides a strong stability and flexible work, which is such as outpatient clinics, facilities, and continuous growth, and new techniques and specialties. So the combination of impact and the variety and like the security and connection between the patients appeals to me, and I would say appeals to most people who want to be interested in PT. Next, the important qualities to be successful. So when interviewing my person, they said that there's people skills, knowledge of strength and conditioning principles, leadership skills, being able to help direct people, communicate well, and they're all important in making people more successful at this job. And some things I would like to add was empathy and patience and understanding patients' frustrations, problem solving and critical thinking, which is assessing symptoms, identifying the issue, coming up with exercises, the physical stamina, which is being able to stand, move, lift, assist patients, the adaptability and flexibility, modifying approaches when patients respond differently to different things, and attention to detail. Pursuing this field. I would still consider pursuing a career in this physical therapy career because it combines my interest with healthcare and the ability to maintain a meaningful impact on people's daily lives. After learning more about the profession, I appreciate how PTs use problem solving, communication, hands on care to help patients regain mobility and independence. Although the job can be physically and emotionally demanding, the rewards, such as seeing patients improve and return to the activities that they love, make the challenges worth it. Overall, the balance of science, patient interaction, and long term career growth continues to make physical therapy an appealing path for me. And here are some of the pictures that I took at the site. The picture on the left, you can see some of their facilities, some of the equipment that they have. And to the right, you see the three main doctors there, and they're a little description of them. And the left, as you can see in some of the corners, was some of the tables that they do their cupping or needling on. And where I'm at is the waiting kind of area. And the picture to the right is just more of the equipment, more of the area, and just more of the building. And yeah, that's it. Thank you.